What we're finding is that by bringing the payer right to the table, and again, this idea of engaging stakeholders early on and actually co-creating new models in partnership with payers seems to work the best. And if I can provide one example, as we were working on this model of e-consultations, the idea there is how can we share a Mayo Clinic specialty expertise and not require patients to come to the physical site, our Mayo Clinic. We actually learned from our own physicians that somewhere in the range of 15 to 30% of patients that they're currently seeing in the office practice, so the traditional model, could be seen virtually. Now, granted, we have many patients that there's a peace of mind that goes along with seeing the physician in the office setting, and we never want to get in the way of that. But we have many patients where it's a significant burden to travel to Mayo Clinic, to spend a night or two in the hotel. So how can we share that specialty expertise to people at a distance? We had that idea, and we actually partnered with our largest payer in the state of Minnesota, Blue Cross Blue Shield. So they actually insure about 3 million of the 5 million Minnesotans that live here in our state. And the CEO of Blue Cross Blue Shield at the time, Dr. Mark Banks, really saw that as a significant opportunity to rethink how care is being provided and to do it differently. So we came together and we developed the model together, and they basically saw the advantage of providing that kind of care in a way that still would have the quality outcome, but to do it in a way that's more affordable, that could then be more accessible to Minnesotans. So we actually created a subscription model, so trying to move away from the fee-for-service office-based practice to our specialists are here in partnership with the primary care provider to provide unlimited, e-consultations, if you will, to meet the patient need and then strengthen the primary care provider's relationship with the patient. As I think about patients and people around the United States that are underserved, and I think about such a gem as Mayo Clinic and how we can connect to people anywhere and try to help them by sharing our vast specialty expertise, I think we have a phenomenal opportunity. And the fact that that model started as a prototype in partnership with the payer, in partnership with a physician group that is outside of Mayo Clinic, and they were able to work through all of this in a partnership way, I think would have to be the one that I would say really has demonstrated so many of the methodologies that are important in the Center for Innovation. And it really has such a sustaining business model opportunity now that we've more fully developed the concept. And then we turned internally to develop an internal infrastructure so that we're ready to now more aggressively expand the eConsult model around the state and around the country. With the small pilot that we started with this offsite clinic, we've actually seen more than 100 patients. And now when we look at the patients we've served internally here on campus, and what that means is that if a patient comes here to start their care in Mayo Clinic Rochester, and they're seeing one of our employee community health, which would be one of our primary care physicians or providers, they can go ahead and request the specialty consultation. So the patient can go home, and we can connect that specialty expertise through the primary care provider, but not require the patient to spend extended time in Rochester. And we've served over 1,000 patients this year with that new model that we just began last January. So we're excited, we're building something, and we think that there's significant opportunities to help people around the country and the world.